Honorable Minister of Local Government and Community Development, and I'm speaking about none other than the Honorable Desmond Mackenzie, Permanent Secretary in the Ministry of Local Government and Community Development, Mrs. Marsha Henry Martin, Permanent Secretary in the Ministry of Health and Wellness, Mr. Dunstan Bryan, mayors from all over Jamaica, CEOs, heads of agencies, matrons, inspectors of poor, chairmen of the public health committees, staff, ladies and gentlemen, good morning. It is Mr. Henry Ford which says that coming together is the beginning. Keeping together shows advancement. Working together leads to success. And this is very important because this is a special meeting to discuss the ministries, agencies, and municipal corporations' response to COVID-19. 2 years ago, you didn't know about it. Today, it's on the lips of ordinary Jamaicans. But before we begin in our normal fashion, I'm going to invite Miss Ethelyn Douglas to offer prayers for us. Please make her welcome.
Let us pray. Lord, you are Alpha and Omega, the beginning and the end. You are our ultimate guide and our Savior. Guide us now to look at how we as a nation guide and protect ourselves, look at our vulnerable, and ensure that we are on the right path. Be with us now, we pray. Amen.
Thank you, Ms. Douglas. Ladies and gentlemen, without further ado, without gilding the lilies, I'm going to invite at this time the Deputy Chair of the National Disaster Risk Management Committee, the Minister of Local Government and Community Development, the Honorable Desmond Mackenzie, to address you. Please make him welcome.
Thank you, Junior. Permanent secretaries and mayors and CEOs, heads of agencies that falls under the Ministry of Local Government. And we have some chairmen of public health committees and matrons. This first half of the day's proceedings will take the form of a live press briefing that we will speak specifically to the question of our infirmaries and the various steps that we'll be taking, working in conjunction with the Ministry of Health and Wellness on this matter. As you're all aware, each parish has an infirmary, along with the Vineyard Town and Denham Town Golden Age Home and the Marie Atkins facility, makes this a total of 15 such entity that falls under the control of the Ministry of Local Government, with a population of over some 2,500 residents in these facilities across the country. This latest development involving the coronavirus is of real concern, not just to the wider Jamaica, but most importantly, to those residents who falls under the care of the state in the respective infirmaries and homes across the country. Therefore, we are taking some measures that will help to safeguard not just the residents, but also the staff at our infirmaries. The Ministry of Health will make its contribution to this aspect of the presentation. And then when we get into the other aspect of the program, we will discuss other issues. Well, I'd like to start off by making some announcements as it relates to our infirmary. With immediate effect, we are restricting access and visits to all infirmaries and golden age home across the country with immediate effect. We are also putting a 30-day ban on receiving new clients to the facility. Later on, when the Ministry of Health speaks, we will outline another aspect of what we'll be doing in that regards. But we are not, for the next 30 days, accepting any new residents to any of the facilities across the country. Those who are on the waiting list, we want them to understand the reasons why it is not going to be possible for us to do so. Thirdly, each infirmary and golden age home will now establish a special ward. Some infirmary already have facilities of that nature, but any infirmary that don't find themselves in a position for areas for isolation, we will commence construction immediately, working with the Ministry of Health on the guidelines for establishing these facilities. Maypen and the Vineyard Town Golden Age Home will be renovated as quickly as possible to be used to house social cases coming out of our hospitals. The Ministry of Health, when the Permanent Secretary speaks, will elaborate on that a little more. The Ministry of Local Government will be providing funding to undertake a number of key initiatives in our infirmary. We will, working closely with the Jamaica Defense Force, commence immediate sanitization, cleaning of all infirmaries across the island. Secondly, we will be putting in temporary employment for continuous cleaning and sanitization of the infirmary to be done almost on a daily basis. We are cognizant of the challenges that most of the residents in our infirmary faces. And therefore, the ministry, working closely with the Ministry of Health, will ensure that we provide all the medical facilities that are going to be required, including putting in the necessary diets and diet supplement to ensure that the residents in these facilities have what is required just in case. We are also embarking with the Ministry of Health to undertake training for our infirmary and golden age workers. And we will be procuring the necessary working equipment to supply the staff in the infirmaries to ensure that they are in a position to work without fear of any form of infection. We are also putting in the necessary medical support. The Jamaica Fire Brigade will provide ambulance services in the parishes where ambulance services are available, and those are at least 6 parishes where those services are available. And we have initiated contact with private ambulance services to provide service to the infirmary in case those services are required. The restriction on visits to the infirmary is not if, but it is a must. And the necessary precautionary measures will be put in place to ensure that the workers are properly sanitized and that all the necessary steps that are required is put in place. You have the responsibility on the ground to ensure that these instructions are adhered to. Where there are needs to improve the security to the facility, all those will be put in place because, as I said before, we are dealing with a population of persons who fall in the category of most vulnerable to this disease that is running rampant across the world. I want to urge you, as we make some decisions that will be uncomfortable as it relates to the staff of the infirmary. We have to be vigilant and ensure that the staff follows the guidelines that will be set out by the Ministry of Health and the Board of Supervision and the Office of Disaster Preparedness and Management, ODPEM. One area of the ministry's response is information. The ministry is known as the Ministry of Local Government and Community Development. And therefore, communities forms a critical component of our responsibility. One of the steps that we'll be taking to help to pass on information to the public, especially in communities which might not have access to the internet and other means. An initiative that was started in my constituency with a private company, the West Kingston Power Plant, in which the use of town criers to go to communities to pass on information to the various sectors. It is an initiative that is working presently in my constituency. And the Social Development Commission will be responsible to coordinate with the municipal corporations to establish town criers in each parish, more than one, to go into the various communities with a message. And that message is the message that the Ministry of Health will provide, and that is the information that we are anticipating that will get out to the general public as it relates to what is to happen in regards to the coronavirus. There are some other initiatives which will come, which I will await the government to indicate when, but these are areas of the ministry's response as it relates to our infirmaries. The Prime Minister last week activated the National Disaster Response Council as the deputy chairman of that council. Before we conclude this first half of the meeting, I will give an update on the activities so far of a National Disaster Council. But at this time, I'm going to invite the permanent secretary in the Ministry of Health and Wellness to come now and to outline the medical aspects of the work that will be undertaken to assist us in securing our infirmaries.
Honorable Minister Desmond McKenzie, Minister of Local Government and Community Development, my colleague, Permanent Secretary, Mrs. Henry Martin, Marsha Henry Martin, friends in local government and community development. I could not start this presentation without first acknowledging the effort of this particular group in our fight against dengue. I thought the work that we did November, December, January, in particular around the cleanup, the special cleanup days, was very effective, and we have seen the results because the number of cases for dengue have reduced significantly. We are not yet below the threshold, but we are seeing the benefit of collective action. One of the errors that we made in dengue, and I'm going to call it an error, is that we did not engage with this particular constituent early in our intervention. And we are not going to make that mistake twice. So I would like to take the opportunity to thank the Minister and the Permanent Secretary for convening this meeting and inviting us to engage you and to ask for your participation in what we believe will be an intense intervention to reduce the impact of what we are experiencing now. Now, the strategy that is before us was first delay. So we tried to delay through our restrictions, our travel restrictions, the advent of our first case. The strategy now is containment, to reduce the spread of infection from person to person. The vector for this particular infection is the human being. And therefore, the containment strategy has to be around reducing the interaction of humans within the population. That's a very difficult thing to do. But the science shows, as with the case in China and other countries, that containment can occur if we are very, very dramatic in our approaches. And that is why we have issued instructions for the closing of schools, and we have issued instructions around the gathering, mass gatherings. If I knew that this meeting was going to be this large, I'd have told the permanent secretary that I will not approve this gathering, but here we are. With me today is a very experienced and very knowledgeable public health official, Dr. Simone Spence. Dr. Spence is the Director of Health Promotion and Protection within the Ministry of Health and Wellness. And therefore, I know you don't need to hear from a civil servant, but certainly you need to hear from a doctor. So I'll turn over to the person that I'm sure you need to hear from more than me. So Dr. Spence.
Thank you, Piers. Morning, everyone. And thank you for facilitating us this morning and allowing us the opportunity to provide you with some more information about COVID-19, especially as it is here in our country. All right, so COVID-19, first of all, sharing with you what it means in terms of being a novel coronavirus. And really and truly, all that is saying is that it's new, right? We didn't have this type of the coronavirus existing before it was identified in humans in early January of 2020. And so this is the distinction that is being made. We have other types of coronaviruses which cause the common cold, etc., that we knew of before, but this one is new. Very sensitive. All right, so this slide is just giving you a basic timeline of some significant events that would have transpired over the last now into the third month of the year, but it seems that we have been doing this for so long now. On the 30th of January 2020, the World Health Organization would have declared that COVID-19 was a public health emergency of international concern. And basically what that means is the fact that it had the potential as a public health risk to spread to other states through travel, as well as it would need an international coordinated response in order to look at mitigating and containing the spread of this particular virus. On the 31st of January 2020, Jamaica would have declared a travel restriction on China initially, and then by the 27th of February would have added South Korea, Iran, Singapore, and Italy. On the 10th of March, Jamaica would have recorded its first confirmed imported case of COVID-19, and on March 11, WHO would have then declared it as a global pandemic. And on March 12, we would have expanded our travel restriction to now include France, Germany, and Spain. So it's a group of coronavirus. The coronavirus is a family of viruses which are common across the world in animals and humans, and certain types cause illnesses in people. So for example, as I mentioned earlier, it may cause the common cold. It causes other diseases which are more severe though, and that includes Middle East Respiratory Syndrome, or MERS for short, and SARS, Severe Acute Respiratory Syndrome, both of which often lead to severe lung disease or pneumonia. Based on our current evidence, the main symptoms of COVID-19 are a cough, a high temperature, and in severe cases, shortness of breath. It's a new virus, and therefore there's a lack of immunity in the population. And so because of the absence of that immunity, the fact that we don't have an effective vaccine at this point in time, it means that COVID-19 has the potential to spread extensively. It, however, is also clear from the evidence that we have so far that the minority of people who get this disease will develop very severe complications, enough that may require hospital care, most often that will present in the form of a pneumonia. And a small proportion of these persons, the illness may be severe enough, unfortunately, to lead to death. So given that there is currently no vaccine against this virus, nor is there any specific proven antiviral medication to treat, we therefore have to manage the symptoms that present and provide support to patients who develop complications. The majority of people with COVID-19 have recovered without the need for any specific treatment, and I think this is an important point to reinforce, that most persons, if they contract COVID-19, will actually have very mild disease, just as if we're having the common cold or seasonal flu. And so we expect that the vast majority of cases will be best managed at home, again, just as how we'd manage seasonal cold and flu. Just to note from this slide that we would have operationalized our Ministry of Health Emergency Operations Center being fully activated for preparedness and for response due to the possible introduction of this disease into our country. Now, just before I take you through the current status in terms of the Jamaican situation as it relates to our numbers, the World Health Organization puts out reports on a daily basis. The last report out would have been WHO Report Situation 52, wherein every day they update how many new countries are added to the list, how many more cases that we have. And so I want to indicate to us that if we want reputable, reliable sources of information, the World Health Organization website, the Pan American Health Organization website, CDC, and our own Ministry of Health and Wellness website are the reputable, reliable sources of information in terms of the numbers, etc. And so this situation, Report 52, which was uploaded yesterday, we have 4 new countries or territories: French Polynesia, Turkey, Honduras, and Ivory Coast. And in the region of the Americas, we have 20 countries currently that have reported cases. And in the Caribbean specifically, we have Dominican Republic, St. Martin, St. Bart's, Martinique, and French Guyana. And I know we'd have heard overnight on the news that Guyana has reported cases and Trinidad, but WHO seeks to validate and verify the information before updating their reports. Important to note that the countries in the Caribbean, the cases that have been reported are imported cases. And this is the same for us here in Jamaica. So I want to take us to this slide now, and we'll look at the last row where to date, after we diagnosed or confirmed our first case on March 10th, we now have a total of 8 positive confirmed cases, and all 8 cases are imported cases. That means that we do not have local transmission. Yes, but it's still associated with imported. Right. So in terms of the breakdown of all the patients of interest that we would have had, or persons of interest, currently we have 4 national quarantine facilities, but 3 are currently occupied with a total of 43 persons of interest, 17 in the first facility, 11 in the second, and 15 in the third, giving a total of 43. Government facility quarantine at VJH, we currently have 1 person. On home quarantine, we have 8 And at hotel quarantine, we have 2 for a total of 54. We have a total of 13 currently in isolation. And persons often ask, what is the difference between quarantine and isolation? And so quarantine simply means that these persons are not symptomatic, or what we call asymptomatic. That means they're not having any flu-like or common cold symptoms, the cough, the sneezing, or the fever. But they are high risk enough that we need to be closely monitoring them for the development of any signs or symptoms of the disease. And the incubation period for this virus is 1 to 14 days. And so this is why persons are kept in quarantine for 14 days, so that we can monitor them over that period. Based on the research and the evidence that is currently available, we recognize that persons on average start to display symptoms around day 5 and day 7 of that incubation period, but we will always have persons across the entire spectrum. Some will present earlier than day 5, some obviously will present later than day 7, and so the complete timeline is 14 days. In terms of isolation, it means that the person has displayed some symptoms associated with the disease, and therefore we need to ensure that this symptomatic person, minimizing the level of risk and spread to others, is screened, tested, and then we say whether or not they're negative or positive. So currently we have 13 persons. So out of the 13 persons that we would have had in isolation who would have had some sort of sign or symptom, 8 of them have tested positive. Okay? All right, so I don't want to confuse persons with these numbers, but we did some modeling within the Ministry of Health and Wellness, trying to look at our past experience with H1N1, which is influenza, in 2009, which was the last flu-like pandemic that we had, and sort of looked at what were the potential increase in terms of the number of cases from this. COVID-19 is similar to the flu. What would in terms of our capacity, especially as a public health system, to handle the number of cases we potentially could see? All right, so is this pointer working? Yes. No, the pointer. The screen is on this side. Yes. Sorry. So just focusing on these numbers in the larger boxes initially. So in terms of acute respiratory infection, we have about, estimating that we would see about 2.668 million persons for the entire period of the year. Okay? In terms of number of persons who would seek medical care, about 889,000 persons for the year. Please keep remembering in a year. 411,853 would possibly seek care in our public health facilities, and just under 1,800 would have severe acute respiratory infection. Those are the persons who are severely ill that would require admission to our public hospitals over the entire year period. And this is just a modeling exercise to sort of help us to plan and possibly project and predict what it is that we would therefore require to support these patients. Okay? The numbers that are in the smaller boxes that look at peak week. On each of these numbers, what that is saying is that in the peak or the height of the outbreak, when we start seeing the increase in the number of cases, this is the amount of persons potentially at the height of that outbreak that we would see in the peak week of the outbreak. And so the peak week is usually estimated to occur about 8 weeks at the infection point or the turning point. So most of us in here, or some of us in here, would know about what we call a bell curve. So at the peak of the curve, that's the 8-week point, and then it tends to head down. Okay? Okay. PS, you coming at this point?
Okay, so now we're going to talk about the plan. The plan fundamentally has 4 stages, and right now we are in stage 4. So we'll focus on stage 4. Don't go too far. Right here is where you're needed, because when they start to ask me questions, it's not me. All right, so stage 3 is where we are at now. Now, a pandemic is just a global epidemic. So what we're saying is that most countries would have been impacted or affected by a particular epidemic. And the epidemic here is COVID-19. Now, COVID-19 is the disease. The actual virus is now named SARS-CoV-19, okay? And so, SARS-CoV-2, right. So the virus is called, but the disease is called COVID-19, right? So we are at stage 3, the pandemic phase. But we're at, so the pandemic phase has 2 sub-phases. Pandemic with cases and pandemic without cases. We are now pandemic with cases. And therefore, the actions in the plan are different. Now, the strategic areas that we want to do in this plan is about planning and coordination, monitoring assessment, prevention and containment, health systems response, and communication. And that's where we're talking to you. Because now you must begin to implement your plans around these strategic areas. The objectives of the plan: to give direction, to support the emergency response, to monitor and evaluate, and to mobilize resources. So within your different spheres of responsibilities, you have to develop your own plan that tries to achieve these objectives within your organizations, within your institutions. The main activities that we want you to focus on is coordination, surveillance. Case management is left to us in the Ministry of Health. Readiness of your health systems, we are to look at that. Monitoring of supplies, laboratory response. So most of these actions are going to be at the center at the Ministry of Health. But for you, public education and communication are critical components of the plan that you need to participate in with us. These are just the groups of different players that we want to participate in the plan. But for the municipal corporations and, by extension, the infirmaries, what are you to do? The first thing is your development of your disaster communication plan. If you don't have one, pull it together. How do you begin to communicate with your stakeholders, telling them what to do, when to do? The minister spoke to your heightened infection prevention and control procedures, cleaning of facilities, cleaning of institutions. Now, the Ministry of Health and Wellness has put out some protocols relating to cleaning and hand hygiene. I'm hoping that everyone would have received those protocols. If you're going to use sanitizers, please ensure that the sanitizers have at least 62% alcohol/ethanol content, okay? 62%. If it's below 62%, it is useless. So when you're going to buy, when you're going to use your procurement to buy, make sure that your procurement does that. For infirmaries, make sure the minister has already outlined a very structured system of cleaning infirmaries. Now, it's very important because the infirmaries contain the highest persons of, in terms of vulnerable persons. The disease, one of the reasons also that why we close schools is that children are sometimes, from what we're seeing from the evidence, children are least impacted, but they are active vectors. So they will only exhibit a cough or a cold in most instances. Yes? Yes, doctor? But when they sneeze on you. When you clean their nose, it's you who clean their nose, and then you get impacted. But it has a different impact as your age group goes up. So grandma has the child is not well, grandma takes the child, and you know how grandma behaves. But when grandma takes that child, she has a different response to the disease than the child. And that is why we are saying to persons, keep the social distance, implement your infection prevention control in all your facilities and at home. And at home. Wipe down those surfaces at home. We don't like to use brand names, but in these situations, we have to speak to the brands that meet the specification. Clorox bleach has the required ingredients to deal with the infection prevention and control in terms of cleaning surfaces. It has been shown to be very effective in killing this particular virus. Okay? So we don't like it, but we have to do it. Clorox bleach. Your business continuity plans. This is now where we are talking about how do we keep operations going in times of crisis. Now in this situation, it's how do we keep the operations of your organizations going when you may have a high absentee level because persons are ill. But before we get to that, how can you prevent people from coming to work at all? Meaning, how can we put in smart operations and still be productive? Can we introduce technology that says people shouldn't come to work, but they work from home? Those are types of things that we want you to now investigate and begin to develop your plans to do that. You have to action your HR policies for absences. Now, the Ministry of Finance and the Public Service has now issued a circular that says that persons who are quarantined will be required to get special leave. Okay, and they have outlined a procedure for getting special leave. But if you become ill, you transition to sick leave. And the necessary rules and regulations pertaining to sick leave would apply. You understand where I'm going? But for quarantine, so for example, we quarantine the entire family for patient 0. But they have work, but they're not sick. So we have to introduce special leave. And the Ministry of Labor and Social Security has issued some considerations for the private sector that they do not punitively treat with persons who have to go in quarantine. You understand where I'm going? So you have to look at your HR strategies under Pillar 1, which is planning and coordination. Now, the situation monitoring, you have to look into now that we're at stage 3, your situation monitoring is not only international, but it's local. What is happening in your local community? Now, one of the things that we have done is that yesterday we announced the flight that the 2 persons were on, and we have announced the funeral today. I don't remember the name of the deceased person right now. Gloria Clark. So if you know someone who was at the funeral of Gloria Clark, tell them. No, it's not too late. It's not too late because the evidence as we have it now is that persons who have not yet begun to show any sort of symptoms are very unlikely to be transmitting the virus. And therefore, if the person went to the funeral of Gloria Clark and have not begun to show symptoms, they should now self-quarantine. Stay home, observe the social distancing, don't engage, practice your hand hygiene. If you start to sneeze or cough, you contact us. So you're supposed to contact us once you went to the funeral. Let us know if you're okay. If you're not okay, then we will begin to give you some instructions on what to do. Call the numbers that are in the public domain. Okay? So the internet. So Jamaica has now 2.8 million people. We have 2.8 million surveillance officers. If you know somebody who call, let us know. Let us know. The strategy now is containment. We want to contain the spread. So everything that you can do in your situation monitoring, you need to do that. You need to identify your security threats, prioritize your essential services, and establish a COVID team in your organization and mobilize those, especially in the infirmaries. Every infirmary, our recommendation should have a COVID team that is responsible for executing all the actions in that facility relating to COVID-19. Okay? Identify the risks in your organization and begin to manage or mitigate those risks. Or if you can, eliminate the risks that you have identified. Now, in terms of prevention and containment within the organization, the minister has outlined several steps that we intend to take in terms of cleaning the facility. But you must make sure, at least, at minimum, all bathrooms have soap at all times. Also, you must make sure that all bathrooms have hand towels. The least amount of times that you handle the doorknobs and the door things, because a lot of people go into the bathroom, wash their hands, wipe their hands, throw away the hand towel, and then touch the door. So you have defeated the purpose. Wash your hands, wipe your hands with a hand towel, use the hand towel to open the door. And then as soon as you leave the bathroom, sanitize your hand. If water is there. Water. Well, we have made that known as a risk that we need to adhere to. So implement some standard operating procedures within your organizations, especially in the infirmaries, so that the nurses, the attendants, even the secretary knows what she's doing. Because the secretary in the office, you might seem to be a docile, uninterrupted, unaffected person. But she may be impacted, and she just touches a surface. Now, the science is showing us that the virus can live on surfaces if the surface is conducive for about 2 days. No, my research says 2 days. Huh? It varies, but I think the longest amount of time it can stay is about 48 hours. So someone can sneeze on a surface today, and tomorrow you come and you touch a surface. And stay away from your face. Stay away from your face. That is critical information. Stay away from your face. It's difficult because every minute I touch my face, I have to fix my glasses, or my face scratch me all the time. But you have to know, understand that it's not business as usual. You have to come out of your comfort zone. You have to come out of your comfort zone. It is not time for you to operate in terms of business as usual. Provide support to the health sector, which we will be doing. So the whole business now of the transfer of patients, social cases from hospitals, is because we are now at stage 3 and we are pandemic with cases. And we have already begun to see the trend of how the disease moves. Starts with one imported case, and you have more imported cases, and then you have what we call local spread, where we can identify the person who has infected the other person. So, for example, you would have seen from the press release that the father of patient 0 is now contaminated. Okay? So we are seeing the imported case, and that imported case has now impacted someone locally. Okay? So we are seeing the signs that the epidemic is just being very scientific in its approach in Jamaica. But what we know is that containment is critical, and therefore your infection prevention and control is critical. Your personal infection prevention and control, your household infection prevention control, your community infection prevention and control, your organizational infection prevention and control, and your national infection prevention and control. Now, for communication, it is critical. Yesterday, for example, long before the Ministry of Education published the fact that schools were closed, I got a WhatsApp because I'm in a group for my son. And I got a WhatsApp message with the Ministry of Health's logo saying schools will be closed as of X time. And I thought to myself, wow, somebody sat down, cut and paste the ministry's logo, type up a message, and put it in. So what a piece of idleness. Is it? I mean, what a piece of idleness that somebody would find time to be so mischievous within the thing. So what Dr. Spence pointed out is critical. Or if you see something on social media, validate it by going to the sources that you can trust. Validate it before you then retweet it or like it or resend it or put it on your status or anything like that. Validate it. And if it's validated, then you can be free to circulate it. Validation, simple process. Take up the phone, call somebody who should know, or go to the websites that would know. WHO, PAHO, the Ministry of Health and Wellness, or even the Ministry of Local Government and Community Development. By now, you would have some sort of access point, or ODPEM. Sorry, I forget about you, sorry. By now, you should have a page on your website dealing with COVID. By now. If you haven't, I encourage you to take that step. You must also create opportunities for engagement because people are distressed. People are distressed. More information you have, it can lead to less distress. Don't forget your family. You must engage at that level, providing whatever information you have to your children, your wife, your husband, anybody in your household, to allow them to not panic. Because that's what we're seeing now, panic. All right? And ensure that you communicate with your stakeholders. At this time, I'm going to stop for any Q&A. Right. So I am being advised to reiterate the point. Reiterate the point. Don't repost any information unless it's from a valid, authorized information source, okay? So that we can ensure that we reduce the misinformation, because it takes away so much of our time when we have to clarify and manage that type of process. Q&A. There's a mic, so I will be guided by the mic.
Morning, everyone.
Mics.
Can we allow
That's what I was going to ask, if we are allowed to ask questions or it's just the media.
can we allow the media to pose the question now? Because once that is over, I'm going to ask the ministry to remain for 10 minutes so we can take some questions. But can we have the media, you know, if this portion could be for the media? Okay?
Hi, good morning. Rochelle Williams from Jamaica Information Service. I'd like to find out, you had mentioned ambulance support from the Jamaica Fire Brigade. Can you say specifically which parishes this will be
Commissioner,
supplied to?
can you come to respond to those questions, please?
Morning, everybody. So we'll be offering service out of Trelawney, St. James, Hanover, Westmoreland, and St. Catherine.
And the remaining parishes that are not, don't have access to the service, we have already started the process to contract private ambulance companies to offer the service if it is required. All right. I'm going to take some more questions now for the Ministry of Health. So if mayors,
Thank you, Minister.
no controversial question.
It's a question to the team from the Ministry of Health. It was mentioned that we should, when we use the bathrooms, that we should use hand towel, hold the doors with the hand towel, etc. In most public bathrooms at like restaurants and so on, they now have the air dry machines, whatever they are called. They don't provide hand towel. So is there any way that the Ministry of Health can compel them to provide hand towels? Or would the onus be on persons to walk with their own hand towels?
The responsibility for your health is yours. It's yours. I know that the culture in Jamaica, we tend to believe that the responsibility for our health belongs to the ministry and the government and the hospital and the health center. But we have been changing that conversation by saying that prevention is always your first course of action. So if you know that you may be going to the public domain and there may be deficiencies, because you have no guarantee, there may be deficiencies, then it is onus on you to just put something in your pocket or your purse or something so that you can execute your own hygiene protocols as you go through your public engagements. So that's it. I don't think we would be able to instruct persons in the public that way. We will provide appropriate guidance to private establishments, which we have done already, to increase their infection prevention and control measures. Yeah.
I have two questions, and one is a follow-up to the fire brigade. Minister mentioned that 5 parishes are equipped with ambulances for the responses. Are these ambulances specially retrofitted with the necessary tools and equipment for the transporting of individuals who are suspected of carrying the virus. And that's for the fire brigade, and there is also the question for the Ministry of Health. I've been listening to the testing argument and the quarantine argument. I still have not been fully abreast. All the persons that have been quarantined, whether it's voluntary or by virtue of information that you have received, are all these persons being tested? If so, why would the period of 14 days be necessary if persons are tested and they are negative in the carrying of this virus?
So I'll go first and then a colleague from Fire Brigade. All right, so remember we spoke to the fact that quarantine means that persons are not symptomatic, meaning they're not showing signs and symptoms of the virus. But because, one, they may have traveled from a country that is of interest to us, especially based on our travel restriction, we want to closely monitor them to see if they develop symptoms within that time period. So that subset of persons aren't going to be routinely tested. Persons in isolation are the ones who would be tested because of the fact that they now have developed signs and symptoms of the disease, and therefore we want to confirm whether or not these individuals actually do have the disease. If those persons who are tested in isolation then are found to be negative, they would be discharged from isolation and would not be quarantined for a 14-day period. Okay? So quarantine means they are quarantined for the 14 days because they are not showing any signs or symptoms of the disease, and we are monitoring closely to see if they develop signs and symptoms. If they do, those persons are then isolated and then samples are taken from them to be tested to confirm whether or not they do have it.
My reason for asking this question is that I'm privy to a case where an individual traveled, exhibited symptoms, and is requesting to be tested. The person has been isolated, but no testing has been done.
So I can't speak to that specific case because every case is assessed and evaluated. So remember we're also in flu season, and there is a specific case definition, especially for COVID-19, that a protocol that we follow to ascertain the risk and the likelihood of it being COVID-19. And so then based on that evaluation and risk assessment, it is determined whether or not these individuals are brought into quarantine versus isolation, and then which individuals are therefore then tested.
I think just one more point of clarification, and I will ask the doctor. There's a specific point in which you can test someone. Now, if they are not symptomatic and you test, you will not get any information that helps you, because the virus might not be there with sufficient volume for you to know whether. So I might test a person that is not symptomatic at all, and it might come back negative, but it's simply because the virus has not yet taken hold of the in terms of the number of particles to make you unwell.
So is it that after a number of days, it might that this person who was...
Right, so if you remember what Dr. Spence... Yeah, man, no, and there's no question that we are not saying. So what we're saying is that the virus has a incubation period of 14 days, but it begins to begin to display itself after 5 to 7 days, right, doctor? 5 to 7 days. But if you now test, once the person, remember, early, you might get a negative, and then say, all right, the person don't have COVID, send them home. But then after, you begin to. Yes, man. No, no problem, no problem.
We're going to ask the fire brigade to respond to the question, and following that, we're going to break for the media to leave so we can get back to the meeting and continue the question and answer.
Thank you, Minister. In response to the question raised by His Worship, Councillor Scott, the ambulances that we operate, they are equipped to deal with patients displaying signs of respiratory symptoms. We have gone one step further this time around, and we have worked out a protocol with the Ministry of Health as to how we treat with an individual who may be displaying signs of flu-like symptoms. We have also gone one step further, and we have procured some protective equipment, our gears, for our firefighters: gloves, goggles, masks, and protective gowns. So they are equipped.
All right, thank you. As I said at the beginning of the presentation, that we would have a two-part proceedings, and we are coming to the end of the first part. But as I indicated, the Prime Minister activated the National Disaster Risk Council. And since then, the council have been meeting. Several meetings have been held with the Ministry of Health taking the lead. We have been meeting with several donor countries and agencies. There have been several interactions that have been taking place, and we would be recommending to the Honorable Prime Minister to convene another meeting of the council so that a full update can be given to the country on the progress that has been achieved so far since the council has been activated. I want to urge all of us before we leave the feed that this is probably the most critical period we have ever experienced as a country. We have never had this level of concern amongst the Jamaican population that we are experiencing now. And this is a time when we collectively, not for selfish or personal gains, but collectively, all of us should become a part of this crusade to work to alleviate or to minimize the effects of the virus. I am confident that the local authorities possess the requisite responsibility and skills under the circumstances to work to achieve the objective. So I want to thank the Ministry of Health for coming, and we will continue to work with them, and we will take a short break to allow the ministry to get some more personal questions outside of the glare of the media. I just want to advise that we're going to be proceeding. We have the SDC, we have fire, we have solid waste, we have the Board of Supervision, we have the Office of Disaster Preparedness, and we have the mayors. And all of you were asked to come prepared to speak to the concerns you have and to make whatever suggestions, recommendations that you think is going to be necessary in responding to the crisis. So when we get back, we are going to move into that phase where we will take those comments from you all.